so glad you're back. We've had a lot of great conversations in the past couple of months, and none better than when my dear friend, Dr. Margie Scherk, is here with us. And I always like to remind you how lucky you are, because Dr. Scherk has a wealth of knowledge that is sought after by veterinarians around the globe, and having the opportunity to share it with good old cat lovers is really the most amazing, right? Let's get it right from the expert. To me, you are Elvis plus probably maybe Katy Perry, and then I need another younger reference, all wrapped in one. So I'm beyond thrilled to be here with you today.
Well, thanks, Liz. It's always a pleasure meeting with you, with your bubbly, sunshiny energy and your passion for cats and passion for helping people who love cats. So we have that in common.
And today, this is a topic that, cancer is such a big, scary word. But I'm really hopeful that with all the information that we're going to be able to share today, that we can sort of take down the anxiety and think about it a little bit differently and more open-minded for hope, and then management and wellness. And that it, certainly there are times when there's not much that can be done, but instead of this overwhelming fear of and dread, what can we do, and how can we really think about cancer differently? So I'm really excited to do that with you today.
Yeah, and it's really important always to think not only in that, not only the getting the diagnosis and making our decisions, but always basing all of that around what's best for the kitty. Because as much as we adore and love them, and we want them to be with us forever, and we can't imagine not having them with us, we have to make our decisions, try and imagine what it would be like to be in their skin bag, what it would be like to be in their skin bag, so that we're experiencing or imagining, what their headspace and their physical experience is, and being empathic towards that.
So you actually made a wonderful agenda. So if we go to the next slide, people can sort of get a sense of all that we're going to cover today, because we love taking questions, and we love the feedback. So that will give everybody a chance to understand what we're doing and where we're going, and then we'll take off from there. So tell us the flow you want to follow today.
Yeah, so I wanted to start with getting an idea of how common cancer is in cats, and what are the main types of cancer in cats, what we should be looking out for, and what might be happening in our cat that might make us be suspicious of cancer but not freaking out yet, so that we can make take him or her to their doctor and figure out what we can do to figure it out, and then what sort of treatments are available, when and under which circumstances we might be able to cure it rather than put the cat into remission, meaning where they're not having any signs of illness, and then setting some realistic goals so that we can manage this. And that goes right back to our presentation. Was that in October or something, our chat, when we talked about end of life and palliative care, and really making things good for them, right?
Yeah. So let's start about how common it is, because this is, if you have a cat, it's realistic to think that this could be part of your relationship. Yeah. Talk to me about that. What's the information there?
Yeah, so I mean, the numbers are actually surprisingly high. They're not as high as cats getting kidney disease or becoming hyperthyroid or developing diabetes as they get older, but it is certainly, it's been cited as being as high as 20% of cats. And that's not got to do, I know some people say, well, it's because we're giving vaccines or because we're feeding commercial foods or whatever. And no, au contraire, in fact, it's the opposite. Those things are helping them live longer, and the longer you live, the greater chance there is to develop everything from chronic kidney disease II type of cancer. So it's simply the age of the cells.
I love the perspective on it. Just to know that this is actually a gift that you have a life this long, and that, you know, if cancer is going to be a part of it, you know, how are we going to manage it? Because I think, I don't know, I've had cancer touch my life many times, and with my loved ones, not myself just yet, but the days you get are the days that you get. And the less,
and that's true whether there's cancer involved or not. The days you get are the days you get. And I think that the like many of us in this YouTube Zoom community right now, perhaps like you, like me, are not afraid of dying. Or not afraid of death. It's the process of dying. And what we're afraid of there is, or at least for myself, is I don't want to be in pain. I don't want to lose my dignity, my cognition, because that's horrible, just horrible. And Alzheimer's like syndromes occur in cats too, but nowhere to the same degree as people, and physical disabilities that go with it. So those are the things. It's not, and if we try and split that out and see what we can do to address each of those things, then I think that takes away some of the fear, because it's not this big bad capital C cancer thing.
So I think one of the most interesting things, if you're not medical, is what even is cancer? We think about it and it's like just scary, right? Yeah. But what is it? What does it even mean?
Cancer means out of regular, where your cells are growing without being properly regulated, because it's normal for cells to be born, as it were, and cells to grow old and cells to die, just like the whole organism, like our whole body does that as well. But each of the cells does that too. And normally when you have, in the top of this slide, you can see that normally if there's mutation in the cell, and mutation happens all the time. We all have many little mutations going on as we speak, and more while we sit here are occurring. And they're from just normal background exposure to sun. I'm not talking about melanoma, but I'm talking about radiation from the sun, exposure to the maybe chemicals in our food, but also exposure to other people's smoke. Lots of things, and there's lots of things we can't control as well as can control. Prevent mutation coming from, but and those cells will properly die. Normally they get mopped up, cleaned up and die. But in cancer, those cells multiply. And so you end up with like one little cell that's got a mutation, like in the bottom, the cell with the pink star in the middle. Then those guys multiply and multiply and multiply, and they start taking over. And so it's a very rapid, uncontrolled growth. Now, I also want to make sure that people understand that we all are on the same page about the word tumor. Tumor is not the same thing as cancer. Tumor just means a growth. It means a swelling. I mean, if you've got a great big zit on your face, that's a tumor. Okay, so when you hear somebody using the term tumor, it doesn't. That's yet one less reason to panic. A tumor could be cancerous or not. The other thing that's important to recognize is that while cancer is uncontrolled growth, which tumors aren't necessarily, uncontrolled growth, you can have cells that are that do bad things and spread, and you can also have uncontrolled growth of cells that they simply become a lump, and that lump may not do anything, or it could be problematic because it smushes something, or it sits on something causing pain, rather than it invading a nerve or traveling through the lymphatic system to the lymph nodes, and then from there to other places.
And the other thing I wanted to say about the uncontrolled growth of these cells is they can't do their normal job. So they are sort of taking up space and interrupting the needs of the other cells.
It's kind of like they're trolling.
Yeah. Yes.
They're your body's trolls.
Of your body.
And it makes it harder for the other cells to do their work.
Yeah.
Keep it under control. Yeah.
And then also, I mean, we could get too in the weeds here, but the blood flow often isn't proper to, as cancer gets bigger and bigger, the blood flow gets disrupted, and that also can cause problems. So, and each one of those can be different. And in a way, one of the good things that we have is it's a little bit predictable. We can sort of, if we know the diagnosis of what the actual cancer is. So let's say we feel a lump or we see something on an exploratory surgery or something, that biopsy that we take and send to the lab to get a confirming diagnosis, that gives us sort of a roadmap.
Yes,
it could
it does.
go left, it could go right, it could go straight. And these are the timeframes that we have, and these are the medicines that are available to us that might be helpful. So
Right.
this is why when we feel a lump, we get the, but let's go to your next slide, because number one, not every lump is cancer. Number two, even if it is cancer, it could be that there's a lot we can do for it. It could be that we actually don't really need to do much for it at all, because it's just going to hang out there and not be a big deal. And if we need to do something, it really helps us to know what it is so we know what to do.
For sure. It's just like, this lump on this cat's face, that's probably a tooth root abscess based on where it is. It could be a cyst, which is just an annoyance. It could be a foreign body reaction. Maybe he's got a grass on in there or something like that migrated through his mouth. Maybe it's not in this location, but it could be a lipoma. Lipomas are, I keep saying I've got lipomas around my tummy, which is not true. That's just postmenopausal fat. But that said, it's, lipoma is out of control growth of fat, and in one region. So they're like these fatty lump somewhere. And another clue often is, although it's not hard and fast, is that if something ends with like the lipoma, for instance, the LIP part refers to lipid. So that's fat. And the oma tells you that it's out of control growth, but it's not, it's an oma rather than an arsenoma, like not a lipocarcinoma. Carcinomas tend to be the bad guys, the malignant ones, whereas omas tend to be the benign ones, the ones that are really more an annoyance and potentially cause discomfort if, as I say, they're in an awkward place.
So let's go to your next slide about what you're doing a great job of explaining that there's a lot of different things out there.
We want to make it, we want to make it usable rather than a talk about cancer. Yeah. So the types of the cancer that cats get, from a study in 2020 from New York, from the Animal Medical Center there, they published in cats, because they had some dog data as well. The orange is the cats. And you can see that the types of cancers that they were seeing in cats were a lot of omas. Like here you've got an adenoma, which isn't a terrible thing, this apiconduct adenoma. Remarkably, quite a few similar numbers of squamous cell carcinomas, and those are really bad guys in cats' faces and mouths. Some other sort of soft tissue sarcoma, again, tend not to be, I mean, if it's a fibrosarcoma, it's a bad thing, but so the lipomas, lots of lipomas, as I said, not a big deal. And then these are these are the NOS, means that they've got a bunch of them that were all different categories, and so they just shoved them together. And lymphoma is really the one we tend to think of as being super, super common. If we go to another more recent thing, see how different it is in different parts of the world. This is in a paper also from the same year, from cats in Italy, and these were European short-hair cats, so no purebreds in there. And you can see the paler gray is malignant, so the really bad guys. And these are the locations rather than the types, as it were. And then the benign ones are the darker gray. And so you've got, again, quite a few with skin. And I saw that somebody had mentioned that that their cat had died from melanoma, and melanoma is actually not, and I'm sorry to hear that. I'm glad you got 18 years together, 18 good years. Melanoma is it is not very common in cats, and as a bad disease. You can get some little guys on the face that aren't terrible, but just as you had chosen to not treat it, and that's absolutely fine, because there aren't really any great treatments other than what the surgeons like to do, which is, if in doubt, cut it out. So if we sort of summarize here, from the top four in cats are lymphoma. They are, and that's generally a good one, because that one we actually do have chemotherapy. So using drugs, again, the word chemotherapy sounds pretty scary, because we've all known somebody who's been on chemotherapy, and some people have had some, and some have worse than other responses, with vomiting and hair loss and retaining water and all this kind of stuff, and just generally feeling really crummy. But with lymphoma, cats tend not to, the drugs that we use tend not to be so bad for that. Plus, when it's intestinal or alimentary small cell lymphoma, which is very common in cats, it is they can be treated. They don't even have to come into the clinic, which is often the worst part for them. That's a cancer that you just treat at home. Every couple of days you give them, meaning literally every 2 days, not every couple as you feel like it, but every 2 days you give them one drug, and you give them chlorambucil, and every day you give them prednisolone, and they can live for 4 years, and they have no nasty side effects with that at all. Squamous cell carcinoma, which I mentioned before, that's a really nasty one in the mouth and on the skin. Mammary cancer, also not great in cats at all. It tends to be very malignant, and cats, of course, they don't just have 2 boobs, they have 8 to 10 boobs. And so, when for surgery for them, you don't just remove the affected boob, you have to remove the entire chain, like all 4 or 5 down one side, plus ideally also the other side too. So it's a big nip and tuck.
Explain why that is, because we think about our human selves, and we might just have a lumpectomy, or we might just have to have a mastectomy where one breast is removed. Why is that cats, it's such a big deal?
It just likes to, it's a very aggressive cancer that likes to spread through the lymphatics. And the way anatomically cats' boobs are connected, they're connected in the chain sort of from the top, on the way down. Thanks. It's a splint for my, not a cast, it's a splint for my first surgery. I just had comment there. And then also going across, they connect, right to left, right to left, right to left, right to left. So like a double-breasted suit coat jacket. And so it's just really nasty. And so that one, you really do have to do an aggressive surgery, and then also put them on a drug called doxorubicin. I don't like the term chemotherapy because it has so many negative connotations. It's really just like you take antibiotics for an infection. You take these drugs that slow cell growth or kill the most rapidly growing cells when you have cancer. So I prefer to think of it that way. And then fibrosarcoma, which has, there are lots of different kinds, but the one that has gained most popularity, or most press, I should say, not popularity, but most press are those that are associated, that have occurred associated with injections, injections of any sort, but those have gained a lot of hits, as it were, dislikes, because that's the injections are something we've done, and so nobody wants to be causing any problems. They also, if a combination of big aggressive removal plus chemotherapy, and in that case also radiation therapy for the injection site sarcomas, is very helpful. But you have to get them early. So, and then technically, I mentioned not all cancers are bad. I mean, technically hyperthyroidism is also a cancer, because it's an adenomatous hyperplasia, or, adenoma being a gland. So adenomatous being the adjective describing that gland, and hyperplasia being rapid excessive growth. And when you get a scar or something, that's also hyperplasia. And so that's so it's akin to, and it really is a benign type of cancer, and yet cats can live for freaking ever with hyperthyroidism. So,
and we're actually getting some questions about lifespan. So Dana mentioned that her cat is being treated for lymphoma, if I'm reading that correctly. And she's wondering, can they live a full life with it? Is that realistic?
What type of lymphoma?
See, this is where we get to our diagnostics and why they're so important. She didn't include that information.
Okay.
Let's see, small cell lymphoma.
Okay, so small cell lymphoma is they can live 4 years easily. It's that, you know, and we're just becoming, maybe even longer, because we're just becoming, they can live a normal life expectancy. We're just becoming aware of how many cats get small cell lymphoma of the intestinal tract, because so many cats we've diagnosed with IBD or inflammatory bowel disease, it turns out it's actually it's actually small cell lymphoma. And this gets to be that gray zone where at what point is it inflammation and at what point is it cancer, and where does the one become the other? And that happens in people too, where, for instance, melanoma, if a cat is hit in the eye, has like trauma to the eye, am I getting that right? Melanoma, right? Yeah, they can develop cancer later on in life or not. Women who are repeatedly hit for instance, in the breast, that could mutate or cause mutations to occur from the inflammation, and then instead of just having inflammation and all the other stuff going with it, you could develop cancer there. So this is it's often, you know, chronic exposure to something that causes inflammation. So I think that you can say that, you know, your kitty's probably going to live a normal life as long as it's being treated.
And, you know, I want to go to your next slide, because Paul said that his cat has been losing weight, and so it got checked for hyperthyroidism. The vet said that was negative, but the cat's still losing weight. And so, sorry, I had skipped ahead one more to when should we be suspicious? But so, what signs are we looking for? Because if your cat's losing weight and the blood tests are coming back normal, what are we thinking?
Well, that's where we need to start thinking about doing more testing. So the things, along with things like weight loss and loss of appetite, are generally secondary signs. Abnormal swellings that persist or grow, so that you actually have a tumor, a lumpy happening there. That's something that is that you should definitely pay attention to, as we've all been taught. You go see your doctor if something is persisting or growing. Sores that don't heal, bleeding or discharge for no known reason, an offensive odor, problems eating or swallowing, all of these things can be secondary to the cancer itself. Because, for instance, with weight loss, certainly it can be that you feel kind of crummy, so you're not eating as much, or it could be that you are not digesting properly, so you are losing more nutrients through your feces, or maybe you're vomiting, or having diarrhea, difficulty eating. Maybe it hurts you to eat because you've got something going on in your mouth. So just imagine, just feeling really crummy. And the odor, of course, if you mentioned the blood supply to tumor or to cancers, and there's a point where there's increased blood flow, because there's increased blood flow needed to nourish these rapidly growing cells. But there's also a point where if the mass gets so big, it outgrows that blood supply. So then you end up having necrosis or death of those cells in the center of that mass. And so then even when we do a biopsy of that, it may come back and we think it's an abscess, because we've just harvested the yucky mucky dead cells from the inside of that tumor. And that's why it's really important to know what you're biopsying and how to collect a good biopsy sample.
And I think, often the things that we dislike the most, like litter boxes and what's in them, and stink. Nobody likes that, but there actually is a ton of information there, because a cat slightly fishy breath, or you could have some anal gland that you're smelling, but for the most part, your cat shouldn't stink.
Yeah.
And so it's not that your cat is bad or, wrong, but it could be that there's something going on. And usually that stink is a bacteria or yeast. And that's a clue that it's something we need to look into.
Yeah. So again, with you could have, bad smells are most commonly in cats from their mouth, because their teeth, they need dental care, and maybe haven't gotten that. But let's say they've had dental care and their breath is still bad. Well, it could just be like one of my guys, my 18-year-old. He just has always had a stinky mouth, even though he gets his mouth cleaned his teeth cleaned twice a year. But he still has. That's just him. But certainly worked it up because that's certainly a concern for mine. Another source, as you said, anal glands. Also, in the upper intestinal tract, so stomach and esophagus can be a source of smells too, right? Especially if they burp or the like. But also the lungs, the airways can also be a source of smell as well. And then when they groom themselves, be it either, lung, airways, upper airways, upper intestinal tract, digestive tract, or teeth, then they groom themselves and their coat stinks too. So if your cat stinks, they should be, so it's worth checking out what's going on.
Yeah, because that smell is saying something's up.
Mm-hmm, mm-hmm.
Yeah, and then I like the loss of stamina. Let's talk about that.
So loss of stamina, that could be from lots of things. I mean, the energy is going towards growing those aberrant cells. So rather than having, and loss of stamina is sort of an odd term for cats because that implies that they actually will do anything for a prolonged period of time other than sleep. So that's a little bit, it's like when they say with, sign of heart disease in cats is decreased exercise tolerance. Well, not in cats. But because they don't do a whole heck of a lot, but hesitation to exercise, like if they want to play, and they otherwise, that's something we talked about too previously when we talked about senior cats, is that cats don't play less when they get old. If they play less, it's not because they're old, but it's because there's something hurts or something's not right inside them. So if they're only sort of batting at the laser pointer or batting at the feather or whatever, and not actually getting up and wanting to chase it, again, be suspicious. There could be arthritis. Doesn't have to be cancer, but something's wrong. There's something wrong. Age is not a disease. Diseases happen more commonly in older cats because cells, even healthy cells, even non-cancer cells, are going to die and be replaced. And so as the older you get, the more cell death there is because you've had more radiation, you've been putting more stuff into your body that can harm cells.
And I love that you put up the difficulty breathing and then urinating and defecating, because that litter box, although you might hate it, if you are scooping it every day, what's normal for your cat. And so all of a sudden, if there's giant clumps of urine in there that weren't there before, or the feces has gone from normal to rock hard or normal to liquid, these are clues that it's time to make a vet visit.
Yeah, absolutely. There was a question whether breast cancer can affect males as well. Absolutely, it can, and it can it can affect males, females, intact or surgically altered, so spayed or castrated. So yes, it absolutely can attack both.
Go ahead.
Sorry, Liz. You go ahead.
No, go ahead. I'm just delighted to move on. So
yeah,
there's so
that came out wrong.
each one. I mean, there's so each topic, and particularly if you've had a personal experience with your cat having one of these things, each one of these, it can feel like we could talk about it forever, and I could talk about it forever.
Yeah.
We have a question about prolonged steroid use. And I really want to get to that, but let's wait until we get to how do we treat it.
Sure.
First, I'm kind of obsessed with diagnosis. So how do we diagnose it?
Well, we always want to make sure that, we need to get sample of the tissue wherever it is, so that we know for sure that it is cancerous or not cancerous. Is it an abscess? Is it a cyst? Is it, something totally different? And oh my gosh, foreign body, we need to do something, we can cure it. Or is it a cancer? And if it is a cancer, what kind is it? Because, and then, not just what kind is it, but is it only in that location or is it in multiple locations? And that's called staging. So, and we can get cells that there's pluses and minuses, advantages and disadvantages of each, and that cytology generally doesn't even need sedation because it's putting a needle into the lump, unless it's internal, of course, in which case that's a whole different story. But if it's superficial, and then we can get those cells. Now my husband is a clinical pathologist, so he looks at cytology all day long, and the results that he can report depend to a great deal on the quality of the sample that he's been given. So garbage in, garbage out. And this is why I say, if you go into the center, and you don't know, but if you go into the center of a mass and you get, this gray or gray brownish liquid out, then you go, oh, Hugh, it's an abscess. It could be just an abscess, but it could be the center of a necrotic or a mass that has outgrown its blood supply. So yes, you submit that, make slides from that, but then you also want to go back with a fresh syringe and needle and get samples from the core, the outside of it as well, to be sure. Then there's different ways you can collect those samples and to make the sampling better. You can get, larger cores of larger sort of like little cylinders of tissue rather than just individual cells and the like. That's still cytology. And then there's surgical biopsy, which is like what it sounds. And we submit that for what's called histopathology, which is where the tissue is handled differently. It's not just it has to be cut into very, very thin slices and put onto slides, and then that's stained, and the pathologist looks at that.
And all these things can get very, very expensive, right? Like cytology.
Not expensive at all.
Tell me about that.
So cytology is not expensive because it doesn't require a lot of fancy equipment. It requires the pathologist needs to stain it and look at it under the microscope, but that's generally it. Histopathology is more expensive, not just the processing of the sample, because the tissue has to be fixed. And then it has to be thinly sliced, et cetera, but also, and you need special equipment for that, but also the fact that it's harvested with surgery requires then generally a full anesthetic, maybe sometimes a local if it's external, but a full anesthetic and the whole big deal surgery.
And again, I just want to circle back to, this is how we know what we're dealing with, how we can predict what's going to happen, and what our best choices are. I practiced in a low income area for most of my career. And so we're always trying to find a way to provide the best care with a great sensitivity to budget. And this is always a really hard one because we don't want to spend money on treatment that isn't going to work. But how do we know if we don't do the test? So even though there is an expense there, I'm a big fan of.
Well, yeah, and a friend of mine just contacted me yesterday. Her 15-year-old lab, and this is about the only time I'll mention a dog, even though I saw there was a question in there about a dog, and I know nothing squiddly diddly about dogs. Her lovely black lab has been, lame for about a month, and now she used to walk on that leg, and now she's not even walking on it. And my friend also has some financial concerns, and she did not want to. She was asking me, should she do anything, or at her age, isn't it going to be a cancer? It's a black lab, so 15 is already an old age for that breed. And I said, it could be arthritis, it could be cancer, it could be a fracture. She said, well, if it's, I'm not going to have any surgery done. I say, fair enough, I hear you, but you still need to get an x-ray, because that way, if it's arthritis, you can certainly, you can provide treatment. If it's not arthritis, then you can stop with the treatment. Then you can say, okay, all I'm going to do is treat you with pain meds, palliative. I'm going to treat you with pain meds until you tell me that you don't want to be here anymore, and then I'm going to say goodbye to you. Because it's again, from the patient's point of view, we have to, if we just cover our eyes because we don't want to lose that friend, put our fingers in our ears and pretend it's not happening, and just keep putting her on pain meds and pain meds and pain meds and anti-inflammatories, thinking that because we don't want to hear the word that that she's got a fracture secondary to cancer or cancer itself, then that's not fair to the dog. We have to get an answer, and then we can make a decision. That decision may be to do chemotherapy and radiation and surgery, or it may be to let her live her life for as long, in as much comfort as we can provide for the short period of time that we've got left.
And I think we, as human beings, if we have a problem, we go to the hospital, and it's sort of out of our hands, and they come back to us and say, well, here are the tests we're going to do, and here's the answers that we got, and here are your treatment options. Whereas with our pets, we really have to make all of those decisions as financial ones, and of course out of love and all the things. But it puts in a different responsibility in our hands that can be a lot. And this is where I think I talk a lot about relationship and asking questions, and make sure that you feel comfortable communicating with your vet. Just like your friend called you, we're really lucky if we have a vet in the family, but if not, you want a vet that you can really ask these questions to and understand your choices. So if we're not finding everything out we need to know from these samples, how else are we getting our information?
Well, I'll get to this in a bit about tumor markers and genetic testing, because that's certainly a big hot topic in people, and has become some work's been done in dogs, and it's just starting in cats. But so this is where we still are, and those would be screening tests. They're still not you're still gonna need cells, meaning cytology or a biopsy. These are still just going to tell you that there's a greater chance, for instance, with that inflammatory bowel disease versus small cell intestinal lymphoma. The tumor markers might be able to say, they won't ever definitively say it's this or it's this. What they'll say is there's a 70% chance that it's this. It's like I'm of Ashkenazi heritage, and I have lots of breast cysts. It's just the way it is. I've always had them. They've been followed along really intensively. They change all the time, so it's the way it is. So I could go and have genetic testing done. Okay, and certainly it makes sense given my heritage, etc. That said, though, my daughter said, who's in her 30s, says, I don't want to know. Okay, so now I have there's two factors here. Now I have a dilemma. If I find out that I'm HERS positive, okay, which is the genetic test, if I find out that I'm positive for that, how can I not tell her? Okay. The second thing is, and this is much more important actually, is that I could be HERS positive, so a genetic test positive, never develop this, or I could be HERS negative and still develop breast cancer. So that's where we have some limitations in tumor markers and in genetic testing. Just because you have, it doesn't mean it's going to manifest itself in you.
And this is complicated stuff, because it elicits all of these kinds of questions. But I also think it's an amazing place in science where we are right now, that both human medicine and veterinary medicine are working as hard as they can to get this information and figure out what we can do with it. What does it really mean? How does it impact, just like you said, our decision tree And I think the state of affairs right now, you really encapsulated, as usual, super well. But what's next, and how might these markers eventually impact customized therapies?
Exactly.
The science is really unfolding here in
Rapidly.
incredibly cool ways.
Yeah. So it's going to be, I think, something where, let's say you get a test back where there's a 70% chance that it is cancer rather than that it is inflammation. Then you're going to follow along, recheck it again in 10 days, a month, whatever the heck, the science is showing as far as rapidity of growth or whatever. And also tests can be wrong too. That's something to remember too. But so you're going to follow it along, and then it's going to direct you as to which type. Let's say then you do start losing weight or whatever. Then it's going to say, okay, we need to go straight in for endoscopy. We're not going to be mucking around with other more basic tests. Okay, because we also always have to make sure that we've always dotted the I's and crossed the T's and done our basic groundwork, because there may be other clues in the blood, even though you've got a lump on somebody. Or they're not as energetic or something like that. Are they not as energetic because maybe they're anemic, or maybe their potassium level is low, or maybe, that, et cetera. So, and we always in cats, even if they're strictly indoor cats, and even if when they were kittens, they tested negative for feline leukemia virus and feline immunodeficiency virus, we still need to check them, because especially with feline leukemia virus, it can hide within the cells for decades, and then it can show up. So somebody can test negative. And I remember the first time that this happened to me, where strictly indoor cat, always tested negative. At 14, she starts to go downhill really quickly. We check her for all the usual stuff, kidneys, et cetera, et cetera. And it turns out she had cancer, and that was because it was hidden in her cells.
Before we move on to the next slide, we had a question of, do biopsies ever spread cancer?
Really good question. With biopsies, potentially can, and this is why, for instance, with injection site sarcomas or any other type, it's very important that the way that the biopsy is taken is in the path that if you needed to go after it surgically, that path would be removed as well. It's called seeding. Yeah. The cells.
Yeah, that's important to know. And how about if there's an internal one, like in a liver, or if you're going
same thing. If you've got a liver, or let's say you're doing, I don't know, what other, and some types of cancer are more likely to seed than others are. And again, it's got to do with how aggressive they are.
So let's say now we know we have a tumor, we know that it's cancerous. What is the value of more tests, or is that it?
We need to do some staging, and the staging is, ideally it's one lump. You take huge margins, and it seems ridiculous. You need to take like 3 centimeters, so 3 finger widths of normal tissue on all sides as well as underneath it. Okay, so that's a huge lump being taken out for something small.
That's kind of the whole cat.
That's kind of the whole cat, depending on, where it is. And this is why, if the ejection is being given up in the back of the neck, and don't be worrying about things like insulin or fluids or stuff like that. But potentially, if there's a lump there, you sort of have to take out the cat's neck vertebrae too, which doesn't work so well. So, we really wide margins. And if you, then you also want to make sure that you're examining and sampling adjacent tissues to know if it's in the lymph nodes as well, or if it's spread just locally. And then you need to get 3 chest x-rays, right side, left side, and then one, top to bottom.
So why the chest x-rays? What am I looking for?
Because many types of cancers, but not all types of cancers, like to spread to the lungs. Okay, not all types of cancers like to spread. Not all types of, even if it's one that does metastasize, it doesn't always go to the lungs. But if it goes to the lungs, that's far more serious, because that's going to impact, as you pointed out earlier, the breathing and if you can't breathe, you can't live, sort of thing. And then also ultrasound may be needed too, especially for the abdomen, where we're looking for different thicknesses of things, big, not just lumps, but in the intestinal wall is the intestinal wall is kind of like a layer cake. And are all the layers still regular, or have they decided to now become like a marble cake where the layers are going in and out from each other? That's abnormal. So it's not just thickness, but it's also are they still regular or not?
So skipping all of these steps, I always like to make sure people really understand. If we don't have the information, then we are playing an odd game and guessing a little bit. Even if we have all the information, there's still not like only one way this goes. But each piece of information that we take out, then we have less to make good decisions with.
Right. Each piece that we don't have, we have less, not take out as in remove from the cat, but rather.
No. I mean, take out from our toolbox. Yeah.
That we lack.
Yeah.
And that's where, again, these tumor markers and genetic testing may help to add a little bit and help to streamline. So I just thought, we could talk about where we're at with these tumor markers.
This is fascinating and it's very groundbreaking. And sometimes we'll get so much progress really quickly, and sometimes it seems
Thank you,
slow.
COVID vaccines.
Exactly. So tell us where we are. What about these tumor markers?
Well, where we're at, the first one that was looked at in cats, and it's been looked at in dogs for longer, was one called thymidine kinase 1, or TK1. And it was looked at, it's been used in people, and in people, it's like one of the markers, but you can, again, like I said before, one on its own is never, it's not a yes, no, it's not a green light, red light thing. It's it needs to be used in a suite of markers. So in a sort of a whole package of markers. And the question in this, looking at this paper, this was a review in 2013. So gosh, 8 years ago now, 9 years ago now, that was looked at for gastrointestinal lymphoma to see if it would help with that. They looked at clinically healthy cats as well as diseased cats with lymphoma and other diseased cats as a potential biomarker. It is a test that is available in Scandinavia. There's also one in the US that is where they do haptoglobin, which is a protein in the blood, along with looking at thymidine kinase 1. But that one is, and that one, here we go. They come up with this Neoplasia Index, where, like I said, sort of a 70-30 thing. There's if you have C-reactive protein, haptoglobin, and TK1 being elevated, there's a greater chance of it being cancer, that there's a neoplasia index. Whereas if you just have, if the TK1 isn't elevated, but the other two, the C-reactive protein and the haptoglobin, are elevated, it's more likely to be inflammatory disease rather than neoplasia or cancer. So
it's tough, right? Because I think that we're more like, this is a lot to take in, and red light, green light is something that we can digest, but now we have so many variables. So again, I'm back to the communication with your vet to try to, like, they can look at all this and synthesize it and then say, well, yeah, blah, 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 but this is what it means. This is what it means for you with the rest of the global picture of what's going on with your cat. This is a lot of variables.
Yeah, it's a lot of variables, and they could be, and they're suggesting that it not only used for diagnosis, but they're truly recommending its strength. This company is marketing it for its strength as to monitor progression if the values go up, therapeutic effect, are they going down, and relapse, are they going up again? So, a pretty non-invasive way. But again, taking that within the context of A, there can be incorrect tests. B, if it's a sort of a 70-30 thing, then, there's kind of some wiggle room there. Sherry, I think Sherry's probably got a great relationship with her vet and communication with her vet. She's got a whole hospice in her house, one kitty with pancreatitis, and that's an ongoing thing, herpes, IBD, and diabetes. That sounds like a cat. They always have more than one thing.
Trick there.
One with IBD, inflammatory bowel disease, and the third one with small cell lymphoma. So this is, and the last one so far so good. And they're all from one litter. Fun.
Yeah, and everyone's worried about your arm.
Oh, I had the trapeziectomy. I've got arthritis in my hands, and last year this hand was done in June, and it's keeping me from riding my bike, which is most annoying. And this year it's this hand. So
you're loved. Everyone wants you to be well.
Thank you.
So let's move on with the markers. Yeah.
So the thymidine kinase 1. This was a good blog by VetGirl. VetGirl's a really good thing to really good blog to follow. And in this blog about TK1, the state of the art of biomarkers, what the author said was these individual biomarkers and panels are promising, but not perfect tests and should never be used in a vacuum. We still need cells. We still need to look at cells. As in human medicine, we as a profession are still trying to figure out the best use of these assays with regards to our cancer patients. The ideal uses of these tests are still under investigation, like you said, Liz, and being refined as we learn more about the biomarkers and the disease processes themselves. Because disease processes, it's not a straight throw. You don't necessarily start here and then end up there. Eventually everybody ends up dead, but that's not necessarily the disease process, because something else can kick in before that is what kills you, or it could actually go into quiescence for some time. So it's complex, that's for sure.
Yeah, and so each one, I think that COVID has both helped us to understand when new information is coming at us all the time, what do we make of it, and how do we use it in a way that really is productive to make our decisions and assumptions. And sometimes it just is really confusing. So I think pre-COVID, things seemed a lot more straightforward, that it was red light, green light. And I think it's getting clearer that the more tools that we have and the more we understand, sometimes the more confusing it gets.
And to be patient with your veterinarian, because just as Dr. Fauci had one recommendation one day and then different recommendations 5 days later, that's because new things are being discovered on an ongoing basis. And initially we weren't wearing masks because we didn't think it was aerosol spread. We thought it was droplet spread, and we were disinfecting everything we touched and anything that came into the house. Well, it turns out that that's not the way it's spread. So it's we could stop doing that. And so people inevitably felt frustrated and the like, because, well, come on, tell us what to do. Quit changing your mind. We don't know. It's all brand new. How could,
and the way that
figuring it out as fast as we can.
And that's the exciting part. It can seem frustrating, and for some people it can cause them to lose confidence. And I guess that's human nature. But the exciting thing is, if we can be patient and get these tools and use them as best we can, that there's discoveries, and the meaning tools is coming in a big way. So being a part of this process is really cutting edge medicine and extremely cool. Yeah.
So here's some that have been used in other biomarkers. These are ones for dogs that have been looked at. Nu-Q is out there. OncoCanine is out there. There was a recalf blood test out there. That's actually, and look at this. It was this Canadian company BioCurex has announced the development of a blood test that can detect cancer in 85% of dogs with 95% accuracy. That's amazing. The company's folded. Okay, so this is we have to be really, and there's lots of reasons for a company to fold. It could be the way it was set up economically or financially or whatever. But there's also things where so we have to be very discriminating, and also it depends on what type of cancer you're looking for and what the probes are, et cetera. And to not hold to, exaggerate things there. And then genetics, BasePaws, thank you BasePaws for this webinar opportunity, are currently recruiting for for cats, a gastrointestinal lymphoma study. And so, I'm hoping that Casey will maybe put some information in the chat box about that and how to sign up for that. Those of you who have cats with inflammatory bowel disease, or those of you with cats with small cell lymphoma, even if you already have a diagnosis, it might help other cats. So that's a good thing. The advantages of genetics is, there's no, maybe it's simple. It's a swab. It may be that there's no biopsies needed. I don't think that's the case. We're still going to need biopsies to know definitively what it is. And again, you could sample the wrong part and get the wrong answer, but it's still the gold standard. Definitely lower cost and less discomfort. I should have that on there. And the key here would be early diagnosis might be possible. That said, it depends on when you get your cat to the vet too, when you perform these tests.
Katie is talking about just that, of being very frustrated with how long it can take to get a definitive diagnosis. And even then, if you call it all the king's horses and all the king's men, you might not be able to get a lot of time. And it is frustrating, but it's the best that we have. And I want people to know also, your local vet, like good old me down the road in Delaware, is also doing dentistry and also doing skin disease and also doing neonatal care and all the things. There are oncologists. And
more than one species.
Right, more than one species, right? Whereas I love your
MDs only do one species.
and usually only one body part. I bet your surgeon takes out like that bone all day long and that's it. So I want people to know that there are veterinary oncologists out there.
Yeah.
And because that's all they do all day long, that might be a more streamlined approach and answer. It's going to be more expensive.
Yep.
Now with everything, it's hard to get in to see them. But that doctor has done what I did with vets, undergraduate and vet school, but then they also did an internship and a residency and took a bunch more really hard tests, and now are just doing this.
Yeah.
So if you're feeling frustrated, a specialist might be your best bet. But even, it's just not a perfect science. We do the best we can as fast as we can.
Yeah, for sure. For sure. So let's say we've got our diagnosis and we're working our way through the emotional impact of that. So how can we treat it and can we cure it? And I'm seeing here, some people have talked about, like Jen has said that, she's got an 11-year-old cat with GI large cell lymphoma, which is a really stinky kind. Small cell is a much better kind. And then, 3 months. And then with, small cell, or you asked about how if the cat with the same diagnosis had this greater response, generally not, because generally that is a really bad disease. Large cell lymphoma is a short life. What one of the oncologists I learned from used to say, there's good disease and there's bad disease. If they survive longer than a year, it's good disease. If it's less than, and large cell lymphoma is a bad disease. So that's great that your kitty is still hanging in there. And then you also said, while he's in remission, one thing he started to do after treatment was defecating outside the litter box. When it happens, he appears to be distressed and goes wherever he is, but the stool is normal. The doctors aren't sure why. Any thoughts on why this behavior is related or unrelated to cancer? It may very well be related to cancer. It could also be that if it's near the box, that there's something about the box that he's not happy about. Maybe he's not got the strength to get his leg up over that fence stile, because you think about how high the edge of a litter box is, and that's the entire it'd be like us having to climb over a fence that goes right up to our groin. So it may be that by lowering the litter box edge, or by putting more litter boxes around that are easier to access, maybe one on each level if you've got a multi-level home or the like, that might, so indirectly related rather than directly related to the cancer.
So let's say we have our diagnosis and we're trying to say, great, now what? Is it, can I treat it? How do I treat it? What does that look like?
Yeah, so it's, what options have we got? There's, three main types. There's surgery, if you can remove the whole thing, fantastic. You have a whole new cat with a little less tissue in them. And chemotherapy, which is using drugs to kill those unnaturally rapidly developing cells. Radiation, which also does that, and it's very targeted to a specific location to hopefully just get only those bad cells, the ones you want to get rid of. And oftentimes it's combinations of all of them. So like I said, with injection site sarcomas, it's all three. Some of them with breast cancer in cats, it's surgery and chemotherapy, so different things need different, which is why we need to have an accurate diagnosis to know what to recommend. If we're talking about surgery, I mean, surgeons like to say, if in doubt, cut it out, and to cut is to cure. And certainly if we can cure any cancer, it's most likely going to be from surgery, but not all types of cancer can be removed with surgery.
And then if we do remove it with surgery, there can be, like you were talking about, the chest x-ray, or a tumor can be set up in one spot, but this is where the concept of metastasis come in.
Yeah, metastasis are spread, and it goes through the lymphatic system, so through to the lymph nodes, and then to other body parts, to the lungs, or even there's a lung digit syndrome where, you'll see. I was
just going to bring that up.
With with a firm mass on the paw, and you immediately should be thinking about, yes, it could be if it's a young cat, you're more likely to be thinking there might be a foreign body in there or an infection in there, something like that. If it's a middle-aged to older cat, you better take a chest x-ray as well.
And that's so stunning. I mean, it just looks like a little something on the paw. It's nothing. And then it is something big. As a vet, I always hated that, because not that I like any cancer, but it seems like you're coming in for a nothing, and I've got to give you some really terrible news. So to cut,
or news that that's going to be upsetting to you. News that's going to be upsetting. So chemotherapy, where in general, and this gets to the question about corticosteroids long term. Cats handle chemotherapy much better than we do, and so do dogs, although they don't handle it as well as cats do, as far as I remember. But with cats, they handle it really well. And there's one of the reasons is because cats just laugh at corticosteroids. You can bathe them in them. You could shampoo them in it. You could have them swim every day in a, whole highly concentrated corticosteroid something. And the doses that cats can take would just do us mere humans in. So long-term corticosteroids, there are some cats who are prone to developing diabetes in response to, and I've seen a couple in the chat here, who in response to corticosteroids. Those cats also are the ones who are most likely to have their diabetes resolve when they're taken off the corticosteroids. And so if we've got somebody with a condition where corticosteroids are absolutely necessary, then I'm going to just handle the diabetes on the side. I'm not going to stop if somebody's got cancer and they need corticosteroids, the diabetes is just a side. Pardon me, I'm not trying to make light of diabetes, but it's sort of a sideshow. We need to take care of the cancer.
And what about heart disease and steroids?
Oh, heart disease and steroids. So that's one that somebody has to have underlying disease, and it may be hidden, it may be occult, and that we didn't know about. So if you have this is why when you have somebody with, especially if it's an older cat, you should be screening annually or every 6 months, regardless. But if you have somebody who is ill, you need to be thinking about not just the limp. you need to be thinking about, okay, where's that limp coming from, that lameness coming from? Is there, and what's the rest of the body? What's the condition of the rest of the body before we start considering the treatment for that lameness? Like if it's for instance, if somebody has arthritis, how are the kidneys doing? Because that's going to affect the dose that you feel comfortable using of non-steroidal of arthritis medication. If somebody's got heart disease, it's going to affect the route of the type of corticosteroid you use, or is there something else that you could use instead of a corticosteroid? So this is why you still have to, don't forget the groundwork. You still need to have your groundwork.
Yeah, you got to have the whole picture.
Yeah, get the whole picture. And the thing with chemotherapy is because cats and again dogs don't live 80 years or 90 years. Our goal is not so much to, if we can eliminate the cancer completely, fantastic. But in people, they're prepared to have, and less so these days, but it used to be that they were prepared to have 95% of human patients on chemotherapy have some side effects because the drugs, they needed to be able to kill all the cancer cells to make you live for longer. In cats and dogs, especially dogs, because they don't live as long as cats by and large, but the added life that you might get them if they didn't have the cancer, would only be maybe 3 years or something. So do we really want to wipe them out for that time? No, we don't. So what we're looking for is remission, or getting rid of the clinical signs that are making them sick and that are causing them problems, rather than curing them. And the other thing, the reason I sort of made a caveat with respect to people, we now have so much better targeted drugs that are less likely to cause the bad side effects. So cats are extremely, extremely unlikely to lose hair, get diarrhea or vomit. They may, I think the biggest side effect with cats is them being terrified from having been at the vet and then coming home and hiding under the bed for a day or two. And that's a very real concern, and something that we have to take into consideration. So there's very negligible physical side effects, but they could have psychological and quality of life side effects. So if you don't know whether you want to put your cat on chemo or not, get on the bus, get them on the protocol and see how they do. And if they don't do well, you can get off at any bus stop you want. But if you don't get them on the protocol, then you may never be able to catch anything. The bus will just leave without you. So
things are too far along.
They're too far along. So this is the thing, is better, nip it in the bud and you've got a way better chance. And even if, your cat's doing, the cancer is nicely under control on the chemotherapy, but your cat is miserable and you're miserable watching your cat be miserable, then stop it. There's nothing wrong with it, but definitely give it a go.
And what about radiation? I mean, how accessible is that? What's that like?
So radiation, it's not very accessible. There's not many places that do it, but it certainly has some really great, there's some types of cancer that are extremely sensitive to radiation, much more sensitive to radiation than to chemotherapy. That's the other thing with these three modalities of treatment. Some cancers aren't responsive to one or the other. And this is why we have to know what type of cancer it is. And so radiation is, we can use, for instance, I think somebody mentioned that they had a white cat, and that's squamous cell carcinoma of the ears and the nose is pretty darn common. And while there's some medications you can use, radiation therapy can totally cure it. So again, if you get it while it's small enough, radiation also, you have to be very careful of other aspects. You don't want to be going through unaffected body parts because it will kill those cells as well. So, but a lot of times it's combinations.
So the answer here is that it's really not one size fits all. and that there's a lot to putting together a diagnosis and then a treatment plan.
Yeah. Yeah, and we have to have realistic goals, which means that we have to know where we're starting and where we want to get to, and then the appropriate treatments to get to that path. So that meaning you need to make a plan. In order to do that, you need to start the treatment and then stick with it, or you can get off the bus. Okay, this is different than other sort of management-y type things. And then recognize that the goal is quality of life. It's always quality of life. And if you have, and because it's quality of life, thinking about palliative care, that may be in fact the way we go, rather than, do you yourself, would you rather live 4 years with chronic pain and dementia and not being able to get out of bed and go to the bathroom on your own? Or would you rather live 6 months and still have all of those abilities? So especially given the fact that we are making a decision for another individual. And that's where we end up with an ethical question too. The cat's not telling us what they want. We're the ones who are making that decision for the cat. And we have to be very aware that the cat should have some say in it too. And obviously they can't say, yeah, I want this test, I want that test, no, I don't want that treatment, because they just say no, 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 no to everything, if they could. But there certainly is a point, and I've had this experience, and maybe you have too, Liz, where you look into someone's eyes and you read their body language, and you can see that they're ready to be done. They absolutely would be grateful to be done. And so this is where we have to be careful of who we're treating. Are we treating the person who's coming in with the kitty, or are we treating the kitty? And that also goes the other way, where sometimes, when people are, our pet parents are so upset about things, but kitty's kind of okay with everything. We don't euthanize because the people are upset, because we're not there to treat the people. And, then it is killing somebody, because then it is, then it is taking somebody's life when it's not in the cat's best interest.
And we did a few months ago, and maybe Casey can repost. I thought it was a really thorough and sensitive conversation about end of life issues, because when it's your own pet, you and I can do this all day long for other people and
so
be
hard when it's
objective. And as soon as it's mine, I am a puddle. I can't think.
Yeah.
I'm a disaster. And so it's a lot to it to be able to take it all in and make good choices under both extreme emotional stress and also economic stress. It's a lot. I wanted to add one more thing. I've been working a lot with a company called Tably. It's actually the company, Sylvester, but the app is Tably. So there's this thing
AI learning,
this feline Grimace Grimace scale, because being able to observe discomfort, pain, suffering in a cat is really, really hard. When we're getting to the point where they're not eating at all, and it can be a big mystery, and even more so when we are very emotional, when I'm very emotional. So what the app Tably does is uses this feline grimace scale,
which has been validated and is fantastic.
So we know we can believe
You're taking photos. You take photos of your cat, and the app tells you
whether they're having a good day or a bad day. And then, there's a lot to interpreting what that means and why. But if you're getting that your cat's having a lot of bad days, even though to you it looks fine,
because it's gradual too, right? The changes are gradual,
really
oftentimes.
hard to perceive. And so that can help, I think, making a lot of decisions and with end of life care. So it's called Tably, like tabby cat, but Tably.
Like tablet. Yeah,
Tably, Tably. It really helps to have another objective tool. So a lot of people will use it, and it says this cat's having a bad day, and they're like, no, it's not. Well, the feline grimace scale is validated. So we are not able to appreciate what's going on, but it's a clue to go check.
It's another tool because, just like, I mean, this is a picture of a patient of mine who you can see she's happy as stink there on her person's lap and in the sunshine. And I mean, she's positively grinning, right? But she's, she is, you look at her body, she's skin and bones. I mean, she's so far advanced with cancer, but she was happy in her life. So we just kept supporting her. So for the planning, going back to that session, I think that was November, when it may have been December, when we talked about end of life, coping with end of life. That's about accepting. And that's where, if we can accept the eventual loss and make it about having things be good for the kitty, then through having an end of life plan and really watching and using things like Tably to assess them on a regular basis, then that's fair for the cat and good. And the AFPcatfriendly.com has a brochure about no cat pain. Tably has got this great AI app tool. Lapoflove.com. There's also Gray Muzzle that has so there's some Gray Muzzle's really nice because it actually looks at not just and none of these are just for cancer. These are for anything. Gray Muzzle looks at quality of life with a whole bunch of different things, not just pain, but that's where you could use Tably to get a sense, to gauge the pain, and then plug that into, what the report from Tably, put that into Gray Muzzle. And with palliative care, we're really looking at alleviation of suffering, suffering and is not just physical, it's emotional too. And it's not just in your kitty, it's you too. And so this is where, the Lego bricks are to remind me that it's hydration, nutrition, analgesia, and reducing stress. And that sums up quality of life for a cat. And those four components are not necessarily giving drugs, other than, analgesia will be, but to be aware of how's he eating? Is he eating well? Is he getting enough calories? Is he enjoying his food? If he's not enjoying his food, then I don't care how prescription he should be eating. If he's not enjoying his food, it's better that he eats something and enjoys it than that he doesn't eat, because ultimately, he only has so many days, and please, let's have him enjoy this. Making sure he's well hydrated, even if he's drinking a ton more than he used to. If he's peeing more than he used to, he may be peeing out excess of the amount that he's drinking. It's kind of like overspending your bank account. Not that I know anything about that. So that's, and therefore supplementing them with fluids subcutaneously at home is really helpful. But analgesia, and then reducing stress, making sure all of their resources are available, ways to make giving medications easier so it's not so stressful. So giving fluids and reinforcing with treats during that, or giving medication with treats and the like, so to make it a whole lot more palatable, as it were, pun intended, for them, so that they can enjoy the time. He or she can enjoy the time that they have with you, and you can enjoy that and look back thinking, yeah, I'm really, really sad that he's gone, really sad, but I'm glad we didn't let him go too early, and I'm glad we didn't wait too long. I have no guilt about it because I know what it was. We got those x-rays. We know that it's arthritis. It's not, whatever. And we've treated it as best we can because we had a plan.
And Basepaws and Dr. Scherk, I'm going to speak for you and myself to say, we want to bring you the information that you guys want. So if there's something else that really spurred your curiosity today, let us know, put it in the comments, really let us hear from you about what you want and what you find interesting and helpful. Because Basepaws is pretty much the best at making sure you guys are getting amazing doctors like Dr. Scherk, bringing you this really quality information that you can trust, hopefully in a way that that makes sense to you.
Yeah, just looking here at some of the comments too. Okay, so somebody said here, you mentioned that you get cat's teeth cleaned off, and are you worried about fibrosarcoma occurring? That's why I hesitate to bring my cat to for dental cleaning. I'm not sure what fibrosarcoma would occur secondary to dental cleaning. You're just you might detect a squamous cell carcinoma, which would be what you want to do. You want to detect
I think she's referring to injections.
Oh, I see. Yeah, no, that injection sites. No. Again, with the whole injection site sarcoma, my goodness, there was more research done on that type of cancer than any other type of cancer in cats because of the whole concern that, we would not want to be doing anything and continuing to do something that's actually harming cats down the road. So that's why a lot of research has been done. And it is crazy multifactorial. We have no idea what turns the switch genetically in some cats to develop cancer, whereas others, whether it's injection related or not.
And I think this is where, again, communicating with your vet is really important, because the risks of dental disease and what that's going to do to your organs and all the things is very real and very likely.
And every cat, that's every cat.
And the amount of, and same with a lot of like vaccines and other things that we're going to do. We really need to understand, yes, this scary thing might happen to a small number of cats, but is the care that we're giving for the other problem more important, and that risk far greater? So it is a balance. And in this case, get the dental.
Yeah, for sure. And with and age is not a consideration with anesthesia. You just have to do your perioperative, your peri-anesthesia workup appropriately. And whether it's I saw we had a 30-year-old cat in here somewhere, which is great. Wow. And at 30, I wouldn't hesitate to anesthetize a 30-year-old cat. Because that's the numbers on injection site sarcomas. It's down to something like 1 out of 50,000 cats. So it's really, really small. It's just something, it's one of the reasons we say if you see a lot, and it's also why instead of giving vaccines in the scruff of the neck, we now give them as low down on the limb as possible, so that if this were to happen, we could amputate the limb potentially and have a 3-legged healthy cat as opposed to a cat with no neck. Which is a cat in a box. Yeah.
Well, thank you so much. I know we're always over. We never can keep ourselves to an hour. So for everyone who's stuck with us, it was great to have you here today. And always thank you to Dr. Scherk and Base Paws for bringing this information to everybody. So have a great day. Go love your kitty. Enjoy all your days. And hopefully we'll catch you next time.